Hi, I'm Ninan from Leeds Frailty Education. In our first video, we talked about what frailty is, and now I'd like to talk about how to identify frailty. There are lots and lots of different tools to identify frailty. But do we really need a tool? Can't you just tell if somebody is frail just by looking at them? Well, I'm afraid the answer is yes, you do need a tool. People aren't very good at judging frailty just by looking at them, and we need to do some specific things to identify and assess frailty. This shouldn't be surprising. If you were ill, you wouldn't want people to judge you at your worst, lying in bed after not having slept well and not having eaten well. In the same way, older people may appear more unwell, more physically frail, when they have been admitted to hospital, not having eaten well, not having slept well, and being ill with something like a pneumonia. In the UK, we use the Electronic Frailty Index and the Clinical Frailty Score as ways of identifying frailty. The Electronic Frailty Index is, well, a frailty index. It measures the number of deficits and divides them by the total number of deficits in the model. In the Electronic Frailty Index, the deficits are 36 codes that are already in the GP record, so no extra work is required. Like other frailty indices, the Electronic Frailty Index predicts adverse outcomes, like admission to a care home or death. However, it relies on the quality of the data in the record and shouldn't be used for individual people. It's best used as a screening tool to identify a population of people who have a degree of frailty, like moderate frailty or severe frailty. The best way of identifying frailty on an individual basis is by using the Clinical Frailty Scale. The Clinical Frailty Scale is a validated tool that is used to identify people with frailty. It shouldn't be used to judge somebody when they're acutely unwell. If somebody is unwell, then we should judge them based on their abilities 2 weeks before they became unwell. Once we have identified moderate or severe frailty using the Clinical Frailty Score, we can identify people who are at higher risk from things like falls, care home admission, hospital admission, and we can put in place interventions to try and prevent those things happening, things like falls reduction programs or deprescribing. The Clinical Frailty Scale also helps us provide a common language for health and social care professionals to talk about what's wrong with the patient. Saying somebody is frail on its own isn't particularly helpful, but if you tell me that somebody has a Clinical Frailty Score of 6, then I've got a snapshot of what that person's abilities are and what their risk is. In our next video, we'll talk about how to identify different grades of frailty.